All right. So thanks everybody for coming. As you know, I'm Dr. Garcia from Contoura Facial Plastic Surgery, and we're kind of our second lecture in a series here of what kind of things we can do to improve the aging process. And so it's kind of uncharted waters for all of us with the webinars and the Zoom meetings and whatnot. So I hope that everybody is able to attend. And last webinar that we had, we weren't able to get all the questions answered at the end. I think we have addressed that. I think we have fixed it. The Q&A should be good. So as you come through questions as they come about, I may not get to them directly. However, we will most certainly get to them by the end. So I need to make a few little housekeeping things here. If I go to chat, I can allow all panelists, but I want all panelists and attendees, right? Okay, got it. Okay, so I think that's good. So you should be able to send a question or
it's not just Q&A.
Yeah, do. So you should be able to send a question through Q&A. And I think we have a fairly good amount of participants thus far. So we're going to go ahead and get started. Are we close to 1 o'clock?
1 minute. 1 minute.
Okay. One of the questions that came about last week in the Aging Face seminar was along the lines of how long is the recovery for our typical surgery? There's a significant amount of variation. And what we have found is on average, you have to allocate for most of these surgeries a week, maybe a week and a half of recovery so that you're able to give yourself ample time to heal. And again, that all depends upon how involved the surgery is. But generally speaking, when we're looking at treating some of the lower face aging issues, we like to see patients kind of take it easy for a week to 10 days. So having said that, we're going to get going. First thing, many of you, or maybe some of you have seen me speak in the past, but you're going to see there's an uptick in plastic surgery now. And I've seen it in my career. I've been in practice for a little over 16 years. And I have found that it's much easier now due to many technological advances. And certainly the expenses, while I say they've gone down to a certain degree, they have. And so they've become more accessible to people. A lot of people are trying to stay healthier and looking good for professional reasons, as people want to stay, they want to stay competitive in the workforce, and they want to look pretty much as good as they feel. So we see that very, very commonly. Plastic surgery is much more accepted in the mainstream. When I was coming up, we didn't have social media. That was something non-existent. So I have seen the blossoming of social media within my career, and I've seen the acceptability of plastic surgery. There's no longer this negative stigma. When you compound that upon the fact, and I'll show this today in our presentation as to how we achieve what we like to call the natural look, it becomes much more mainstream because of the natural look, because patients do not look like they've had anything done, only that they look refreshed and they look younger. And so again, this kind of goes along with the whole basic idea in our practice that people want to age gracefully. And so statistically speaking, surgeries are up across the board. Male, female, injections are up across the board. We've seen a big spike in male surgeries as men are trying to stay in the competitive force, in the workforce for longer. And so they're competing with these young bucks, as you will, coming out of college that are competing with them. So let's move on to some basic concepts. My basic credentials, you can probably see this on my website. And when you do come in, you'll get a copy of my most recent book, The Art of Facial Aesthetics. That's my 6th book. We're currently working on our 7th version. I'm the founder of Contoura Facial Plastic Surgery. You might have heard about us in the past. performed nearly 17,000 surgeries, and I've published several articles and book chapters. I'm a frequent speaker at our national convention. I was just invited to speak at the International Convention for Facial Plastics in Boston. They asked me to give 3 lectures, in fact. So I'll be doing that in the fall, God willing, if some of these states open up and they allow travel to and fro. So I am double board certified. I'm affiliated with many organizations that have to do with just head and neck surgery. We have 2 locations, one in St. Augustine, one here. I do not see patients out of the St. Augustine office any longer. My nurse practitioner, Brooks, does, and she runs a very busy and successful injectable practice. So as such, I really don't do many of the injections anymore. And many of you already probably know that I am a specialist in the face. There's very few of us in this part of the country, and there's very few of us in the country, period. So basic concepts. All right, what do we not want? This is a woman who started off as a very attractive woman. Many of you may know who she is. She's Jocelyn Wildenstein. And she had the intent of continuing to have multiple plastic surgeries. And she ultimately began to look what we call lionistic. And so she began to kind of favor more of a feline or a cat appearance. And so she was aptly named the Catwoman. And so I did some comparing, and I found a Siamese cat that looks pretty close to her. So this is not what we would consider natural. And so we're going to do everything we can to stay away from that. So the next question becomes, okay, now we know what we probably want to steer away from. How do we get to that natural appearance? So let's break the aging process down into 3 major components, okay? And I'm a firm advocate of making things as simple as possible so that they become the most understandable. There's something going on with the skin as it ages. There's something happening with gravitational changes of the face. And then we certainly know that there's something with volume loss issues. So we're first going to take the skin issues, and we're going to say, okay, what is actually happening in the skin that we can actually see? Well, as the skin is losing collagen, we're beginning to see more wrinkling of the skin, more loss of texture. We're seeing more brown spots and discolorations, only because the surface of the skin and the bottom of the skin, where all those pigment producing cells called melanocytes are, they're getting closer and closer and closer together. So every time the surface of the skin is subject to sun, it stains the skin much quicker. So we want to do something that's going to get that skin that's now this thin, and we want to thicken it back up. And so it all comes down to a process of rebuilding collagen. Now, when you look at what changes occur in the collagen aging component or the skin aging component of the aging face, it's quite simple. We're losing collagen. And it's projected that we lose about a percentage of collagen every year. And so that comes down to the fact that in the first 28 to 30 years of our lifespan, we are in what's called a trophic phase. And that's where we're constantly building tissues, okay? After the age of 30, we enter into what's called an atrophic phase. And that's where we begin to lose tissues. So you can imagine, mathematically speaking, most of our life is spent in an atrophic or tissue loss and tissue aging phase. And so we begin to lose collagen, and a breakdown of collagen, as you can see here in these fibrils. So as a result of that, collagen has been forming kind of a lattice structure that's supporting the skin. And so think of a bridge that's supported by a lattice structure. If you start cutting out beams, the bridge is going to buckle, it's going to bend, and so you're going to start seeing changes in the surface of the skin, such as this hollowing, wrinkling, and again, closer to the deeper components of the skin, which is what causes a lot of the staining. So anything that we're going to do is going to work to thicken that skin. Now, what is it that you're doing? Well, basically, with procedures like skin resurfacing, and today we're going to focus mostly on chemical peels. And because we're working on the upper third of the face, chemical peels are very, very effective for the finer skin that we see around the eyes. And keep in mind, the reason you begin to see wrinkling around the eyes early on is because the skin is so thin to start with. So it takes the it takes the least joke, less joke. I don't know what it takes less of a joke. And so it gets impacted much quicker because of the skin changes that you see. Certainly the lines that are around your eyes that are caused with animation. Now the difference between animation lines and what we call static lines is simple. If you raise your forehead and a line is created, that's an animatory line, okay? If once you stop moving your forehead, you have lines at rest, those are called static lines. Static lines are going to be addressed with resurfacing procedures. Lines that are created with animation of the face are going to be helped with Botox and some of the surgical procedures that we might recommend. So the second component that we see of aging is the gravitational component. So most of us know about that, but how does it affect the upper third of the face? So I have a schematic of a lady who you can begin to see some of the flattening of the brows, which is a normal process in the aging continuum, and you begin to see almost a vertical descent. Now, this is the only part of the human face that ages purely vertical, and you can almost take pictures of you, or you can go back and look at pictures of yourself 5, 10, 15 years ago, and you'll see a gradual flattening and dropping of the brows. Now, it happens in a very systematic and a methodical manner. The outer parts of the brow are usually the first parts where you begin to see that kind of hooding process. And so as a result of that, several things happen. As that lateral hooding occurs, you close the aperture of the eyes, less light gets in, so you begin to lose color to the eyes. The second thing that happens is you start using compensatory muscles, i.e., you start using muscles in this region to now compensate for that hooding and raise your brows even further. So now you start developing those permanent lines across the forehead. I have a few you can see, but and so that's a compensatory mechanism. And so looking at how the brow ages, again, this is the only part that ages purely vertical. So the second thing that happens is it begins to push skin, along with that collagen loss issue, and you begin to see hooding of the upper eyelids, and that's a process that we call dermatochalasis. And you'll see two things begin to happen: loose skin that hoods over the eyes. Secondly, brow flattening that continues to close the eyes. So I tried to draw out a few changes here, but here's a patient who had classic flattening of the brows, and she had asymmetry of the brows. So you can see that her left, our right, is lower than her right side. And so when you actually draw what the brows are doing, you'll see that you have straight lines across, but they're not even they're in an uneven ground. So what we did was we said, okay, we're going to reposition these brows. We're going to recreate that arc. And when you start looking at where the arc should lie, it's going to lie approximately 3/4 of a centimeter to 1 centimeter above the bone. So if you palpate your bone and you feel the bone of the orbit, you want to see that brow almost a centimeter above it. The second thing that we strive for is the arch. So where is the arch positioned? Many of you might see the plastic appearing arches where the arches are too far outward and they begin to look like Spock. So we try to keep that arch more centrally located, right at that where the color of the eye turns to white. And that's right in this area right here. And that's an area that we call the lateral limbus. So we always try to create the high point of the arch in that area. And so when we are creating the natural look, you'll see that the high point of the brow falls here. So what do you see differently between one picture and the other? You see the color of this lady's eyes. They're back. That's the goal of eyelid surgery and or brow surgery. It's to do nothing more than to bring attention back to the eyes. We don't want you to look surprised. We don't want you to look like you just saw a ghost. We want you to be more open and refreshed. And so we'll get on to the changes that you begin to see with the lower eyes now. So we've talked about the hooding of the vertical hooding that occurs with aging. Now, what's happening in the lower eyes? And this is probably a procedure that we perform here at Contoura anywhere from 6 to 7 times a week. And so you're beginning to see the classic signs of aging. Some loose skin here, and you can see the kind of what we call the dermatochalasis, or the loss of collagen in the skin. Then you start seeing this kind of fullness in here, okay? These fat pockets. Now what's happened is the eye ages, it drops down a bit and it pushes fat pockets forward. So it's kind of what we call pseudo herniation. So it's a matter of fat pockets being projected forward. But at the same time, something is happening down in here. And that's what begins to create the ring. So you get a fat pocket above that's falling forward and tissue underneath that's falling back. So you create what we call a double convexity. And I'll get into that in just a minute. So you'll see here that the fat pockets of the lower eyelids, there's 3 fat pockets. And then this blue line indicates this region that we call the tear trough, which is a result of volume loss. And that's really the biggest thing that we came across, was the idea that the face devolumizes as it ages. And this was kind of my eureka moment, if you will, where I took a picture of my beloved mother, my beloved sister, and her daughter, and I noticed something, that the triangle of the face changed. My mother, if you notice, had flattening in this area and more width down in here. The youthful face is wider here and narrower as we move down to the chin. So why is that happening? Look at this picture of 3 schematics of the same woman. And when you look at the triangle, you can begin to imagine now how that triangle has flipped, how it was strong up top before, now it becomes strong at the bottom. So what is actually happening under the skin? So you'll see here that, let me see if I can get this, if I can get these triangles off. I don't want to lose the slide. There it goes. Sorry. And so here, well, I guess I can't. So on the left picture of your screen is a youthful face, and you'll notice the fat pockets around the eyes, underneath the eyes. They're robust. They're full. Youthful faces are fuller faces. Then as one ages, they begin to lose volume in the cheeks first. These fat pockets thin out, and then you move to the aged face, where virtually there's no volume in the face, and this tear trough region is almost completely devoid of any volume. And so that's really the biggest component of aging around the eyes, is what's happening underneath the skin. And so we're going to talk about a couple issues here of how we address what's above and what's below. But first, we're going to get into why are we losing volume of the face. Okay, now this is a critical thing. And when can you expect to see those changes? Lots of studies have been done on the effects of estrogen loss with volume loss. And we know that there's a certain window in life, in those perimenopausal years, mid-40s to late 50s, I don't know, many women are menopause in their early 60s, but generally speaking, it's mid-40s to mid-50s. And we see a stark decline in fat volume as a result of estrogen changes. And so this is the period that we're really looking for. And so if you look at a classic example of a patient like this, who has, you would think, pockets around the eyes, some hooding in this area, but she's really flattened in here, no volume at all. When I put a schematic of what's happening underneath her skin, you can see how it's just really empty in here. And so what we're gonna do is we're gonna actually work through the problem together. And you're gonna see that she starts off with this absent volume in this face. We need to get her to here, okay? We need to replenish that volume to where we create that youthful face once again. And so what we're gonna do is we're gonna see how, by putting volume back in the face, replenishing the mid-face mid-face volume and tear trough volume, we're gonna be able to achieve a much more youthful appearance. And you're gonna see somebody who looks like a refreshed version of themselves. And that's the goal, to replenishing volume around the eyes and to addressing the signs of aging in the upper face. And you'll see by raising the brows, you see a nice arch that's recreated once again. Hooding is taken off of the skin, and an overall more gentle soft look is given to that upper third of the face, which is what we're after. And so talking about, okay, how do we do it? There's non-surgical and surgical options. I'm not going to confuse you guys. Non-surgical options are going to be centered around chemical peeling, injection procedures, filling in volume with fillers, synthetic fillers, taking away animation lines with Botox, or some of our skincare treatments like microneedling with PRP and collagen induction. The surgical procedures, I also put chemical peels in there because these chemical peels that I do are a little bit more involved. My treatments around the eyes are centered around treating skin with chemical peel, volume loss with fat grafting, hooding with either eyelid or brow surgery. Because I'm a surgeon, I'm going to talk more about the surgical options. And you can read about our non-surgical options on our website. Okay, now let's go through a few cases. And a classic example of patient had, fat pockets underneath the eyes, but significant hollowing here. She did not want to undergo removal of fat under the eyes, so we just camouflaged and we injected fat in the area underneath so it softens the lower face. Another example of somebody who had fat pockets, hooding.
There we go.
Okay, got it. We had a little delay there. Who had fat pockets and hooding of the upper eyelids and hollowing underneath. And so then afterwards, you can see how we're able to soften that the appearance of the lower eyelid, and you're able to see how the upper eyelid now has a better crease, and overall her brows look softer and the face looks softer. We also did some corrections along her lower face. Another example of a man, what we call a negative vector. Basically what that means is the eyeball is in front of the cheek. And so we took fat away above, we built underneath, we fixed the asymmetry between the two eyes. You can see his right eye, our left, has more hooding than the other side. And so afterwards, we have correction of both eyes and improvement in the lower eyelids. He shaved his beard so that he could tell everybody that the reason he looked different was because of his beard, not his eyes. Anyway, close up, and you'll see that it's just a nice soft look. Doesn't look like he had surgery. Took a little bit off the skin, and again, a little bit off of the upper eyelids, softened around the lower eyelids, and again, it's just a softer look. You don't have to do drastic. I want to show different types of examples, and this isn't not everybody is a holy cow. Look at how wide her eyes are open. She just wanted for me to be conservative in the upper eyes, and so we were able to take off. But the overall effect is that her eyes afterwards look brighter and more blue, which is ultimately what we want. The picture that we showed at the beginning when we were showing the schematics, I'm sure you want to know what she looked like afterwards. So we did her upper eyelids, and we cleaned up around her lower eyelids by taking fat out and putting fat back in underneath. Now, I know it sounds contradictory, but keep in mind that what we're doing is we're moving fat in different places. Fat above, hollow below. Taking fat from above, building the hollow below so that we meet them halfway. And again, softening the lower face with a chemical peel. We did a full face chemical peel. We did some fat grafting underneath, and we took out some fat pockets from the lower eyelids. And another example of just kind of removing some of this loose skin and fat, and overall just kind of giving the eyes a cleaner look. We did take some skin off of the upper eyelids, and you can see how much more refreshed she is there. A little bit more of a extreme result here. Again, skin off of the upper eyelids. You can see the crease now that's developed afterwards. Is my mouse pointer working? You can see that? Is it on time with what I'm saying? Okay, good. And then we have fat pockets here and hollowing underneath here. Yeah, so she had pretty significant fat pockets. So we did both. We took out fat pockets and we built underneath. And this was mostly her lower eyelids. Another case of mostly lower eyelids, and you can see here conservative fat pocket removal, but putting fat underneath, soften that appearance. Patient looks just more refreshed. And in a man, classic heavy bags underneath, and then afterwards, oh, sorry, let me go back. Okay. And then afterwards, you know, a much softer look. And again, this is a man who's got very nice eyes. Now his eyes look natural, you know, and that's kind of what you want with men. You don't want to, you definitely don't want to look like you had something done. You just want to look refreshed a little bit. And men do have a tendency to age around their eyes first. And that's typically where we'll see it first. Brow, upper eyelids, underneath the eyes. And you see here, we refresh her eyes. You now see the color back to her eyes, and that's ultimately what she wanted. I think she's on our website. And this one was just upper eyelids. I have up here volume replacement. Sorry, that's my fault. We just took skin off of her upper eyelids. And you can see this is ultimately what you want, right? Just a softened look. Her eyes look a little bit more, the aperture is a little larger. She doesn't have this hooding that's beating down on her lashes all day long, causing her to constantly have to reapply her, is it mascara? Mascara, sorry. Okay, so here, upper eyelids, skin removed, lower eyelid fat pockets. You can see just a nice softer look. I could do this all day long. I have hundreds of examples, but you can begin to see what we're really trying to achieve here. And you can see here a lot of loose skin, okay? Very common loose skin, fat pockets, hollowing, and then afterwards, there you go. You want to see that nice soft look, create a nice almond shape to the eyes, and it looks refreshed. So when you get into, again, the title of this isn't correct, but this lady had concerns with upper eyelids. She's a drug rep. She's very, very busy, and she thought that she had some issues mostly with her eyes. When I saw her, I said, you also have some brow issues. We probably need to improve upon that. And so afterwards, we were able to lift the brows while taking off a little bit of skin of the upper eyelids. I did some fat grafting below to help with this fat, with this here. And so you see, she doesn't look like she had surgery. Her brows are elevated. They're in a higher position, but she does not look like she had a brow lift, right? She just looks like her eyes are more open, and she's got more color to her eyes. Again, I'm going to keep beating on that point because that's the most important thing. And then this is one of my early brow lifts when I was much younger and my beard did not have gray hairs in it. This picture was taken, I want to say around 1 o'clock in the afternoon. And I remember that because she told me when she saw her after results, she could not believe that this picture was taken, that she was walking around like this all the time. So we did a brow lift among some other things. And you can see now, you see the angle and the curve of the brow. That's what you want. She's got these beautiful hazel colored eyes. You have that nice arch to the brow. It's 1 centimeter to 3/4 of a centimeter above the bony rim. The arch point is right where it should be at that lateral limbus. And she just looks natural and refreshed. And most of these incisions that I place are behind the hairline, so you do not see them. This lady had been on we did some kind of makeover thing with her, didn't we?
Yes, she was our contest winner.
Yeah, she was we did a makeup a contest with Channel 4. Channel 4. So we did several things. We did her jawline. We did some fat grafting in her cheeks, tightened her neck, worked in her brow, around her eyes. I thought the biggest change that we saw was around her eyes, because here she looked like she now was 10 years younger. Okay, she looked like a younger sister of hers. And so that's, the way she pulled it, or she wasn't shy about this at all. She was on television, but she changed her hairstyle, changed her makeup a little bit, and that's kind of what we saw. Botox after a brow lift, I'll show you what it can look like. I think that this is a great result in the neck and the jawline. This is a great result with the eyes. I like to see brows a little softer. This is a look that she wanted. She's a beautiful woman, but you can see how opening the eyes are after the brow lift. Now, keep in mind, this picture is only 2 months after, and you can still see kind of pink here. That's where one of the incisions might be located. So you see that they heal really well. And I just wanted to show you this as a different variation of brow lift. And then you see one of my older ones as well. Young girl, no loose skin down here. It was all brow. These are genetic issues. Okay, so a lot of patients are born with genetically dropped brows. And so afterwards, we were able to raise them and again, open up her eyes, much more of a refreshed look, and she's very happy. This patient also, we did lower face. We also did her nose, and she had some Botox already in her brow. So I said, look, let the Botox wear out after we do the brow lift. Don't go back. Let's just get you more to a natural place. And so afterwards, we were able to just soften the appearance. She looked much softer. The brows now in a nice arch, and this is much more open in here versus the kind of the angulated V appearance that you see in the medial brow. And the patient that we showed at the beginning, talking about the position of the brows and the flattening versus the roundness, you can see here afterwards the difference that you can see with volume augmentation to the upper cheek, lower eyes, and then the raising of the brows along with some skin removal. So, and on profile view, I want to show you this so you can see what changes you begin to see in the brow. Okay, so you can see how her brow is just laying on her eyelashes. And then afterwards, by elevating the brow, and remember there's 3 components to the brow. There's a right lateral, there's a left lateral, and then there's a central component to the brow. And so if I were to come back to this picture for just one moment, she has hooding on her right, hooding on her left, but she's got a lot of hooding in here. And the way you know that is because that head of the brow begins to drop inward and it begins to close the distance between the eyes. And so what you want afterwards is by opening it back up, you reopen that angle and that distance between the eyes. The heads of the brows are here, the tails are out here, so you really bring those back out. And then on oblique view, you can see how, I'm pointing at it with my finger. I should be pointing with my pointer. You can see here how she's got that hooding and some crow's feet here. And simply by lifting the brow, you get all of that excess tissue off the eyes. And now you get a nice smooth cheek complex, a nice brow complex. And so what we've really gone over today is simply 3 components. What's happening in the skin, what's happening due to gravity, and then what's happening due to volume loss. So it's never just one thing. I take that back. Sometimes it can be just one thing, but most of the time we're treating things almost from a 3-dimensional perspective, and we're building things for the future. I don't want to just do a surgery on you today and then have you come back a year later and say, oh, well, now I got to address this. I'm looking at your face. Where are you going to be 5, 10, 15 years from now? That's what we're shooting for, is that future you. And so a couple of things that I think are important when you start researching, you start looking for your specialist. Yes, I would love for you to come to see me. This is why I'm doing a webinar. But at the end of the day, I think the most important thing is you find a surgeon who specializes in the face. That's the most important thing. Look at their experience. Look at their before and after photos. If this is, I think the patient satisfaction and the reviews are probably the biggest thing that tells you what kind of doctor the physician and the practice is, because that tells you how they handle everything after the surgery. And then I think that's all I have. I have a couple questions here. Let me see if I can. I'm gonna open this up for questions now. If anybody wants to type in wrinkles around. Okay, so patient has wrinkles around the eyes. Is there anything permanent, not Botox? If you have wrinkles underneath the eyes, then it can be removed with either a skin pinch procedure or a chemical peel depending upon the skin type. There are some individuals who cannot take certain chemical peels. Darker skin patients, as a rule, we try to stay away from chemical peels only because there's a chance of pigmentary changes. But whenever we see isolated lines underneath the eyes, we usually can remove those with a small procedure called a skin pinch. When you see hooding of the, when you see lines out in this area, then that becomes an issue with either Botox or that becomes an issue with lifting the brows. So there's a couple options that we might have. Okay, so I hope that answers that. Where are the incisions for eyelid surgery? The incisions are actually, if you look at your eye straight on, you're gonna see there's a black crease above it, above your eye. That's called the supratarsal crease. The incision is placed right in that crease. So when your eyes are open, you do not see the scar, and it is completely covered. When your eyes are closed, you really don't even see the scar either. So it's placed in an area where when you are in normal life, it's very well hidden, and it's able to remove all of the excess skin. Next question is, how long does the procedure typically take, and can it be done under local? I pretty much can do any surgery under local depending on the patient. Usually the way that we perform these surgeries is we'll give somebody some type of pill to relax them, whether it be Halcyon or Xanax or Valium, and that kind of relaxes you and gets you a little bit tipsy, if you will. And then we use a couple little numbing injections to get you numbed. So any one of these procedures can be done under local. In fact, I usually prefer to perform these types of procedures under local because I do find that the recovery is a little bit quicker. Okay, so how long would surgical volume replacement last? Okay, good question. Fat transplant is or fat grafting is a transplant. So it's not like a filler. Whenever you inject a filler into the face doesn't know what hyaluronic acid is. Never seen it, doesn't know what the heck it is. So the first thing that the face is gonna do is it's gonna encapsulate the hyaluronic acid, which is Restylane, Juvederm, or one of these fillers. It's gonna encapsulate it, and then it's gonna slowly break it down over the course of months. When you look at fat grafting, you're actually injecting fat into an area of the face that the face recognizes what fat is, because at one point it had it. So when you inject it into that area, the face begins to feed the fat, begins to nourish the fat, and it gives it life. But keep in mind, at the same time that you've injected the fat, the normal process of fat loss is still occurring. So what you're doing is you're resetting the clock back with regards to volume correction. So to answer your question in short, fat grafting is really a permanent thing. However, you will always have a need to put a little bit more in down the line. Okay, I hope that answers that. What is the recovery time for a brow lift? Most of our patients are working within 3 to 5 days. So you can have it done on, say, a Thursday or Friday, and on Monday you could be working, nowadays you can work from the computer at home. But you'll just have a little bit of bruising underneath the eyes. It's typically what we see with a brow lift. The sutures come out at 1 week, so you're really, it's less than a week. If I wear contacts, will this affect my eyelid surgery? We like our patients to not wear their contacts for the first 10 days after any eyelid surgery, only because I don't want somebody pulling down on their lower eyelid or pulling up. Now, having said that, if we're only doing upper eyelid surgery and and the manner in which you put your contacts in, remember, everybody's different. Some people pull down, other people pull up. If you are one of those that pulls your eyelid down in order to put the contact in, I'm okay with it if you're very careful with it. Conversely, if you've had lower eyelid surgery and you lift up your eye to put in your contact and you do not disturb any incisions around the eyes, I'm okay with it. But to be safe, I always think it's best to not wear contacts or manipulate the eyelids in any manner for the first 7 to 10 days. All right. Great webinar. Thank you. You're welcome, sir. Okay, next one. What do you do about dark circles under eyes? I've done a couple of broadband lights, helped a little, not enough. Yeah, so this is a good question. Darkness around the eyes is due to several things. Number one, hollowness. Probably the most common cause of darkness around the eyes. It's a shadow. The second thing, and the shadowing can be corrected with volume correction, okay? So think about it. You have hollowing underneath the eyes, you fill in with volume, you straighten out that hollow, you cast less of a shadow. Easy solution. Now, if it's truly the case where the skin is stained, and there are patients that genetically have that, that's an issue called hemosiderin deposition. And that's where the skin stains itself because there's a breakdown of blood underneath the skin. And the only thing that I've found to improve that, there's lots of home remedies and whatnot, but the only thing that I've found to improve that is with skin lightener. So some skincare products that have a skin lightener will really help that. But you know, the best thing to do, let me see it. If you can't come in, call us, send a couple pictures. Let me take a look at it and I can give you some solutions. I'd rather see it in person only because it gives me a better perspective as to what's shadow and what's not. But anyway, okay. Is it recommended that a patient lose excess weight prior to having upper and lower eye work done? These are the only fat pockets around the eyes. These are the only fat pockets that do not respond to weight loss or weight gain. In fact, they have no hormonal influence at all, i.e., whenever you lose weight, these fat pockets do not contract. Whenever you gain weight, they do not expand. Like any other fat cell in your body, we are genetically given a certain number of fat cells, and they're either really big or they're really not. And so around the eyes, we really don't see a change in eyelid aging as a result of fat weight loss or weight gain. All right. I think this is going to be the last question and answer. That's okay with you guys? What is the recovery period after having the surgical volume replacement fat grafting? Heck, you can go to work the next day. So I do have a lot of patients that have it done. Today we did 2 of them. These patients drove themselves here and they drove themselves home. So they're back to doing their normal livelihood tomorrow. What I do ask for patients to do after fat grafting, and I'll go into this in detail with you when I meet you, is I have you use a lot of warm compresses on the fat for 3 days after surgery. That's what I like to see. And so the reason being, the warm gets the blood vessels that are feeding the fat cells and it makes them large. It amplifies them. And so that means more oxygen, more nutrition, more life is getting to these fat cells. So our retention increases and and the actual take of the fat cells is improved. So we have seen that to be a really nice difference in terms of the success of the fat grafting. All right, so I hope that answers some questions. I really appreciate all you all being here. That was really nice. This was a good one. Yeah. So if you have more questions, submit them to info at, I think I have it, hold on. I think I have it on this last page, info at Contoura.com. Info@Contoura.com. You can always contact our office by just phoning us, or you can always go to our website at Contoura.com and go to the chat section and they can contact you with us. But it's been a real pleasure talking with you all. I love doing these. I love teaching. So when you come into my office, I'm never brief with you. I'll go into every detail possible, answer every question you need. I'm never in a rush. So I really, really do enjoy your time, and thank you for your interest in jumping onto our webinar. We look forward to doing a few more of these in the future. So you all have a fantastic weekend and a great Memorial Day, and I hope to see you soon. Thanks. Bye-bye.